Hello everyone, my name is Nicole Getz. I am a BSN student at Indiana State University, and today we will be discussing holistic nursing related to depression and the COVID-19 pandemic. Depression rate during COVID-19. The COVID-19 pandemic has affected many people's mental health. Approximately 4 out of 10 adults in the United States have reported increased symptoms of anxiety or depression during the COVID-19 pandemic. Population at risk. Young adults, 56% reported symptoms of anxiety or depression during the pandemic. This is due to closures of schools or universities or loss of income. Adults with job loss, 53% compared to 32% without loss of job. Women with children. Research has looked at mental health of parents during COVID-19. Mothers in particular reported symptoms of anxiety or depression due to school closings and no child care. So women with children was 49% compared to 40% of men with children. Communities of color, 48% reported from non-Hispanic Black adults and 46% reported from Hispanic or Latino adults. Essential workers, 42% reported symptoms of anxiety or depression, and this may be due to the increasing risk of contracting the virus. Our learning objectives. We will discuss the increased rate of depressive and anxiety symptoms during COVID-19 pandemic. We will be able to define holistic health. We will be able to recall causes of depression. We will be able to identify symptoms of depression, and we will be able to list alternative therapies for depression. Please stop the presentation here and take the pretest in the link below to test your knowledge on the subject. Please return after the pretest so we can continue our discussion. Welcome back. Let's start with discussing what holistic nursing care is. Holistic nursing care addresses the body as a whole. It addresses emotional health, mental health, and spiritual health. The holistic approach to care considers the individual, family, and community as a link to preventing disease. Holistic care is meant to motivate an individual to become involved in self-care to work towards long-range well-being. There are 6 aspects of holistic health assessment. Physiological, this is when the nurse will complete a physical exam. Psychological, this is when potential stressors will be discussed. Sociological, you will talk about your family network and support in the home. Developmental, do social factors affect your mood or behavior? Spiritual, this is where you will talk about your religious and spiritual beliefs. The nurse may need to update your plan of care based off of your spiritual practices. Cultural is where you discuss your culture, any specific dietary needs or values. A holistic assessment is a supportive assessment. It is meant to be non-judgmental assessment to recognize the individual's needs. Symptoms of depression. Feeling unhappy, worried, irritable, disappointed, tired, or uneasy. Not wishing to participate in activities that you once enjoyed. Sleeplessness or sleeping too much. eating too much or having no appetite, experiencing body discomfort that does not resolve, having thoughts about hurting yourself, or having suicidal thoughts. It is very important to talk with your doctor if you feel you have symptoms of depression that are worsening or affecting your daily activities. What causes depression? The exact cause is unknown. It may be a combination of factors related to genetics, biological, environmental, or psychological. It may be experienced trauma or stress or a major life change. Experiencing stress or major life changes is definitely something that we have all been exposed to during the pandemic. Let's finish with discussing some holistic therapies that may help with depressive symptoms. Mind-body practice. Some examples of this are meditation, hypnosis, or imagery. These practices can have a positive impact on the mind and body. Yoga. Yoga is a type of exercise that teaches breathing techniques, which may help a person feel better mentally or physically. Nutritional supplements. Some basic nutritional supplements that may assist with mood are multivitamins, omega-3 fatty acids, or probiotics. Essential oils. This is also known as aromatherapy. Some essential oils, such as lavender or chamomile, are found to have a calming effect. Nature-based therapies. This refers, plain and simple, to being in nature. Being outside can reduce anxiety or depression symptoms. Just the sight of the outdoors can have a calming effect. Music therapy involves listening to music to promote healing. Chinese medicine, also known as acupuncture. This is an ancient Chinese method of healing. This involves inserting very small needles into specific portions of the body in a hope for the body to correct imbalances. Naturopathic medicine. This includes some of the most basic essentials like diet and exercise. Exercise has been shown to reduce symptoms of depression. This takes us to the end of our presentation. I hope you have enjoyed the discussion. Please take the post-test at the link below and check out the handout for additional references for further information. Again, my name is Nikki Getz, an Indiana State nursing student. Thank you for listening.